a moment for the participants to populate. Well, we will go ahead and get going here with today's Tele Town Hall. My name is Andy Labar. I am the Executive Vice President here at the A2Y Regional Chamber, and I want to thank all of you for being with us here today. This is obviously a vital issue that our community, our state, our country, our world faces right now with COVID-19 vaccination. This event is designed to get you the best and most updated information regarding the vaccine in terms of application, availability, logistics, efficacy, and so forth. I briefly want to thank St. Joseph Mercy Ann Arbor, who is our sponsor today. Along with being a sponsor, they're a wonderful member of the chamber and the community here. I want to give a particular thank you to Christy Smith, who is on the chamber's board of directors as our vice chair. Christy, to you and the team there, thank you so much for making this possible. Just very briefly, we do have a luncheon next Monday. It's a virtual lunch, 11 a.m. to 12 p.m. with Congresswoman Debbie Dingell. And so I'm sure you'll want to join us for that, just given the subject matter that she will cover. Much of it may be related to federal action on the vaccine. With that said, just very briefly, let me give a quick overview of our event today. What I will do, starting with Dr. Anu Malani, is give each doctor a few minutes to share just a bit about their role within their organization and how that relates to the context of our discussion today. And then after we hear from our three panelists, we will open it up for Q&A. To start, I will have some questions that have been collected from chamber members already. And then as time allows us, we'll move to audience Q&A via the chat application with a hard stop at 2 p.m. I do want to say that we have an overwhelming response today. We had over 160 attendees registered. And so we will get to as many questions as we can, but I beg your patience just in terms of volume. So with all those things said, let me first turn it over to Dr. Anu Malani. Dr. Malani is with us here from St. Joe. In that role, he serves as the medical director of the Infection Prevention and Control and Antimicrobial Stewardship Programs, and has been the clinical and health system leader on infectious disease, surrounding many of the aspects with COVID, both here in our community, but also within the 92 hospitals of Trinity's system. Dr. Malani, I turn it over to you, sir.
Yep. Thanks, Andy, and thanks for having me. And really a pleasure to join Doctors Cinti and Marquez, who I know quite well, and even before our times with COVID. So I'm an infectious diseases physician. I have been at St. Joe's since 2007, and in these roles, besides clinical infectious diseases, I am the medical director of our infection prevention and control programs, as well as our antimicrobial stewardship programs. And these are really, the infection prevention programs are programs to keep our patients and our healthcare workers safe with respect to kind of all infectious diseases. So as far as COVID, as everyone probably remembers, it was back in March of 2020. It's hard to believe it's almost been a year, but that was actually the first time we had a case reported in our state. And I've been quite involved on all aspects of COVID, both from a infection prevention standpoint, a treatment standpoint, a management standpoint, and more recently with the vaccine distribution and allocation process. So just a few things about COVID, and talking with the other physicians prior to joining on, I just was going to keep my remarks a couple minutes, and then really kind of after they both speak, we really wanted to try to address all your questions. But where we are today, January 26th, 2021, is really the best we've been in a long time with respect to COVID numbers, both from cases throughout the state, which are significantly lower, over 50% lower than they were when they peaked in late November, early December. And as far as hospitalizations as well as deaths, we're seeing a decrease in all those important metrics. And the other really important metric is the number, the test positivity, so the number of positive tests that we see in total tests. And again, Dr. Marquez can share a little bit more about Washtenaw County, but I think that the state is, around 6% and falling, which is really great news. So the other really great news is, while the vaccine allocation and distribution process has not been perfect, we really have two very effective vaccines, and there's likely to be more coming that have been available in the United States since the second and third week in December in regards to approval. And every day, we're vaccinating upwards of 50,000 citizens of Michigan, upwards of a million residents in the United States. And so every day is really a step closer to getting us towards whatever that new normalcy looks like. As far as vaccines here specifically, in our system, we have 7 hospitals in the state and over 90 hospitals in 22 states. We've administered 60,000 doses of vaccine, around 60,000 doses. And based on how much we've been allocated, we've been able to really use almost all of it within 1 week. And that's really the goal from a state health department standpoint, is really not to sit on a lot of vaccine and to try to use that as quickly as possible. In Ann Arbor specifically, we've given about 14,000 doses. We're working very collaboratively with Washtenaw County Health Department, as well as Michigan Medicine, in terms of making sure that we're meeting the needs of the community. Right now, where we are with respect to that, I think one challenge has been is just understanding how much vaccine we're going to be getting and when we're going to be getting it. And that has made scheduling a bit difficult, and I think all of us are probably very hopeful that the transparency around that process will become much clearer in the week to come. So right now, where we are in terms of who we're giving vaccine to, we still are giving it to some of our healthcare workers here specifically in our hospital and through our organization. We've also been giving this to the healthcare workers throughout the community that may not be affiliated with either of the health systems. And then, of course, working very collaboratively with the health department and making sure that we are giving vaccine to essential workers, such as policemen, policewomen, fire workers, teachers, and also making sure that we are providing this to those above 65. So again, I think one of the challenges is that there's clearly not enough supply to meet the demand. But the great news there is that there is demand, and that people want to take the vaccine, which is great. And we'll talk a little more about that. I will let whoever is going to speak next speak.
Thank you, Dr. Malani. I appreciate it. Gentlemen, just very briefly, if for any reasons of connectivity you need to drop from the video just to audio, please feel free to do so. And Dr. Cinti, Dr. Sandro Cinti, who is a professor of infectious diseases and internal medicine at Michigan, at the University of Michigan, and at the University of Michigan, and at Michigan Medicine. He serves as co-chair of the COVID-19 Vaccines and Therapeutics Task Force, which is leading the vaccine distribution effort. Dr. Cinti, I turn it over to you, sir.
Thank you. And thank you, Dr. Malani, Anu, and thank you, Dr. Marquez, for coming here too. So very similar to what Dr. Malani said, we are having fewer cases in our hospital, fewer cases in the ICUs, the intensive care units, which is taking a bit of the pressure off, which is good. We're a little concerned about this new variant. I'm sure there'll be questions about that, and it tends to spread a little. It's not any worse, but it tends to spread a little more effectively and quickly than what's currently out there. So we're watching that in Washtenaw County. We have currently about 40 patients in the hospital who have COVID. About 12 of those are in our ICU, intensive care unit. So we still see quite a few sick patients in the hospital, as Dr. Malani is seeing at St. Joe's. In terms of the vaccination effort, I'm similarly optimistic about getting vaccine to arm. I think it is great that we have such an uptick and such a desire to get the vaccine. We thought, at a certain point, we thought it would be less than 50% of people would want to get these vaccines. But these vaccines are excellent. They work well, and they're very safe. All of those who have gotten their second dose realize that they're going to have some arm pain and they're going to have some muscle aches, but eventually they're going to be protected, and that's the key. We've given at University of Michigan, we were vaccinating within the hospital for a good bit of time in order to get our healthcare workers vaccinated and our healthcare personnel. And then the stadium is also open for vaccinations. The vaccinations that we're doing at University of Michigan, we've done about 35,000. It has slowed down. We have a capability to do quite a bit more. We'd like more vaccine. We'd like to be able to put more vaccine to arms. And the way we're doing it right now is it's by appointment, by invitation. So really we're focusing mostly on our patients 65 and older. And that represents about 150,000 people around the state, including Washtenaw County. We're also part of a university, and so we're the frontline essential workers at the university are also getting vaccinated at this time, and that would include people within environmental services that they can't keep a distance of greater than 6 feet from people, and we're trying to get those folks vaccinated too. But it's tough. We still have some of our 1A, some of our healthcare personnel are still waiting to get their first vaccine, and we're desperately waiting for more vaccine. But we'll be ready when we get it. It will be here. We'll be here to give the vaccine. We plan on expanding to a few other areas so that we can get to other parts of the county to be able to give vaccines. Where there's an effort to go up to Flint and Dearborn, where Michigan has campuses, to give vaccines to the essential workers in those areas too. We're working, as Dr. Malani said, we're all trying to work together within the county, within our hospitals. I think we're going to be getting a group together that's going to be able to meet at least once a week. We've been all meeting at different times with each other, so we all know what's going on. It's a pleasure to be here. Happy to answer questions, and I think I'll leave it up to Dr. Marquez now to take it home.
Dr. Cinti, thank you so much. We appreciate you being with us. All three of you, I know, are taking this time out of a busy day, so we thank you. And let me introduce Dr. Juan Marquez, who is the medical director for Washtenaw County's Public Health Department. Dr. Marquez is leading the medical effort in an agency that has been vital. And Dr. Marquez, we appreciate specifically the role that the health department has played with the chamber and the broader business community in terms of providing information in digestible format. And we very much appreciate you being with us here today. And I turn it over to you, sir.
Yeah, thanks, Andy. Appreciate it. And thanks to Dr. Malani and Dr. Cinti for being on the call. So, I think that, as the health department, we really take, I think, a primary role is what we hope to really do taken for COVID-19. So, as Dr. Malani mentioned, it's been, it's been on since March. But to be honest with you, the health department with our sort of first PUI, so patient under investigation, it actually was January 23rd. So we've been doing this a little bit more than a year at this point. And so, we've really worked on pretty much every aspect of the COVID response. So case investigation, contact tracing, certainly infection control within providing guidance with businesses, long-term care facilities, and then now really with the vaccination efforts. And Andy, as you mentioned, we've done, hopefully have tried to do We have a great communications team, have really tried to push out a lot of messaging about good public health practices that folks should be taking. And so, right now, I'll to echo Dr. Cinti and Dr. Malani that, I think we're very hopeful in terms of the efficacy of the vaccines, about really sort of seeing the, sort of end of the road here, hopefully. But at the same time, it really is continues to be a struggle with the amount of vaccine that is available with here in the county. So, at the health department, we've done the numbers here. So we've done about 6,000 first doses that we've been given. We've set up a site for essentially anybody who is basically doesn't have another home. So if they don't have, if they're not a patient for Michigan Medicine or a patient of IHA or a patient of the VA, or otherwise can't get a vaccine, we've really, I think, served as a primary vaccination clinic for them. And so now we're still working through our 1As, which are the healthcare workers, but have started to open up to 1B, which would be those greater than 65, as well as essential, very, very frontline essential workers. And so we, I think to echo both the sentiments, we're working on basically we get a vaccine in, we get vaccine out, put a shot in the arm so that by the end of the week, we don't have any left over, right? So I think we don't want to be in a situation where we have vaccine that could be given out. We want to basically be, waiting for more vaccine to come in. And I think that's really been our goal in our staffing model to really try to, as soon as we get vaccine, give it out. We have a site over in Ypsilanti, and then we have another site that we're hoping to open up in over on the Chelsea side. And we've worked really closely with both Michigan Medicine and St. Joe's and IHA really to stand these efforts up. So, we are working very closely on a collaborative model with St. Joe's on this site over in Ypsi, and are working very closely with Michigan Medicine on some, outreach efforts as well. That is in the sort of, I think, in the planning stages right now. And then a model I think that we're very proud of. We affectionately call it nurses on the run. And so we have a team of our public health nurses that have gone out and vaccinated at populations that otherwise could not make it to our big vaccine clinic. So, for example, adult foster cares that are not covered by a pharmacy. They've gone out. Folks who have been homebound, older than 65, or caregivers, and so we've had quite a bit of success with that. So I'm excited to answer questions.
Well, with that, thank you again, doctors, and I'll lead right in. We've had questions that came in via email before the event from members. One similar theme is if you could talk a little bit about the safety of the vaccine and what the sort of physical process is to get it, and what sorts of reactions or responses are normal or abnormal, and so forth. I open it up to the three of you as you will, gentlemen.
So,
I think you want to start.
Yeah, I can start, and feel free to add in, guys. So the vaccines have been very well studied. I think important to recognize that, when we talk about Operation Warp Speed, it's a bit of a misnomer because I think it gives the impression that the vaccines, were maybe rushed to market, and that's clearly not the case. I think a couple things to point out is before we even saw a case in the United States, scientists were working on the genetic footprint had actually been released by China actually in early January of 2020. So right away work was being started, and in terms of vaccine development, it goes through different stages. There's safety studies, there's effectiveness studies. One of the reasons why traditionally it takes a little bit longer is there's financial risk, and there's backing, and it takes a while to make sure that you still have the capital to kind of proceed ahead. And I think with these specifically with Operation Warp Speed, is a lot of the financial risk and backing was done by the federal government. And so rather than waiting till all the studies were done, there was a little bit of risk in the sense that the manufacturing process was already started with the hopes that the vaccines would be, safe, effective, et cetera. And that's clearly been the case. And And what we know, at least from what has been published and what's been released, is that both studies are remarkably similar. They both use a similar type of platform. It's called an mRNA technology, and basically what it is, it's almost like a recipe that's encoded in lipids or fat, and it basically is, it has the recipe to make the spike protein for the coronavirus, and basically your body forms antibodies to that. And the reason you get 2 doses, so if it's the Pfizer vaccine, which is 21 days typically, and the Mrna vaccine, which is at 4 weeks, is the second dose is really the dose that helps with your with your memory cells in making sure that there's a robust immune response. And I think what we know from what the data has shown is that with both studies and what's been published is that they were 95% effective in prevention of symptomatic COVID infection. Really, which is an important point, is when we talk about symptomatic COVID infection, we're talking about people being hospitalized, morbidity and mortality associated with that. And I think they've been very safe and effective. In regards to the vaccines, the other thing to point out, and I think Dr. Cinti had mentioned this in some of his comments, is that the vaccines are quite reactogenic. And by reactogenic, meaning that they're associated with some adverse effects. These are typically mild and moderate. They resolve, within 24 to 48 hours after the dose of the vaccine. They're more common the younger you are, and they're more common with the second dose. But the fact that they're reactogenic actually confers that they're immunogenic, which means why they're so effective. So typically, universally, probably most people have some pain at the site of injection. There may be some fatigue, there may be some headaches, there may be some chills. I know with my doses, the first dose I had a little bit of arm pain and a little bit of a headache, but then the second dose, I definitely felt a little bit worse. I had a little bit more of a headache, low-grade chills, and that seemed to resolve within about 36 hours. I'll let Dr. Cinti and Marquez add on.
Yes, I think we, I would agree that with everything that Dr. Malani said, we are very happy with the safety of this vaccine. We've given, as I said, 35,000 doses, probably about 10,000 second doses. There are more reactions with the second dose. Older folks are going to do better, actually. They don't have as much of a reaction in terms of the side effects, so that will be good. Yeah, and to tack on a little bit about how this went through the FDA, just to show you that the AstraZeneca vaccine, which was approved by the UK, was not approved by got an EUA in the UK, was not accepted here yet because there wasn't enough data. They changed their study a little bit, and our FDA would say, no good. We got to wait till the full study's done before we can put it through. And we have advisory committees for both the FDA and the CDC that are experts in our fields, in pharmacy and infectious diseases, in vaccination, and they look at these very carefully. So I want to reassure everybody out there that it's very safe. Otherwise, we wouldn't have let it go to the arm of anybody. So I think that's, Dr. Marquez, you got any other thoughts?
No, I think the other question was like, what's the physical process of it, which is really, I think it's very similar. I don't want to, misspeak for Michigan, but I think it's kind of similar. You make an appointment, you show up, the nurse or the vaccinator asks you a series of questions to make sure that there's no precautions or contraindications. And then you're vaccinated and you're observed for anywhere from 15 to 30 minutes, depending on if you've had reactions to injectable medications in the past or anaphylactic reactions to others, where you have a longer period of observation. If not, typically it's 15 minutes and then you're out the door. So we've I think had pretty good success with that.
Yeah.
Yeah, I just wanted to add on to that as well. Very, very similar in regards to it's not a drop-in clinic, it's an appointment. It's an appointment clinic. And the reason it's an appointment clinic is because, as Dr. Marquez was mentioning, that, for every everyone that's receiving the vaccine, the minimum that we watch them is for 15 minutes. And there are some that we watch actually longer. I think the one issue is, are there any contraindications to the vaccine? There are actually no contraindications. The only contraindication would be is if you had a severe anaphylactic type reaction to any part of the mRNA vaccine. And besides, some lipid nanoparticles, there's really not much in the vaccine. There is a component called polyethylene glycol, which is found in other pharmaceutical products and vaccines. And the thought is one thing that has been noticed that really was not observed in the clinical trials is that there have been some anaphylactic, anaphylactic type reactions from the vaccine. And when you look at the data, it's about 1 in 100,000 for the Pfizer vaccine. It seems to be a little bit less than the Mrna vaccine. And to put that in perspective, your risk of having a severe anaphylactic reaction to penicillin is about 1 in 5,000. So it's a really low, the chances of that happening are, extremely small, but it is something to be aware of.
Doctors, it sounds like what you're saying is Operation Warp Speed dealt mainly with the regulatory and financial aspects and sort of a clearing of the deck of the normal market forces, but that the safety of this vaccine can be trusted, and if it weren't, it would not have been approved.
Right.
Great. A quick question about vaccine reaction that we've had. If there is anything in terms of a more severe reaction or lack of reaction from your body, does that raise any question about the efficacy, or is that just going to vary person by person a bit?
The study, I can answer that. The studies showed that the response, the antibody response, is the same whether you have very severe symptoms or not. So the answer is equally, everybody should be equally getting a response. Some people who are immune compromised are on steroids or have had a HIV that's not controlled, or they may have a lower response rate. But in general, the response to the vaccine itself doesn't mean that you're having a good immune response to the vaccine. If that's the question, right, Andy?
Yes, sir. Yep, that's it. Along those lines, one of the questions we got the most was, from the time the needle goes into the arm, what is the period of time by which we are sort of, for lack of a better term, protected or safer from the coronavirus? And what is our role in terms of spreading it once we've been vaccinated? I hope that makes sense.
Yeah, and so I think a couple points to highlight is that you really need 2 doses of the vaccine, and if you get the first dose, you really need to get the second dose, and that's how you get to the 95% efficacy. There's obviously going to be some dose response from the first vaccine by itself, and you're typically talking about 1 to 2 weeks after that dose. But it's nowhere near the efficacy after 2 doses. And when does one really kind of approach that 95% efficacy? It's really 1 to 2 weeks after the second dose. Now, I think the question then comes up is, hey, do I need to wear my mask? Do I need to socially distance? Do I need to do those things? I think for now you do need to do those things because we're watching very carefully on kind of what's happening, what's unfolding. I think every day is a step of getting to normalcy, a step closer. But when you don't have enough of the population that's been vaccinated or been protected, then there is the potential, that the virus can change over time. So I think what we hope to see eventually is that with better vaccine supply, better distribution, that more are able to get the vaccine, not just the kind of the groups that we've been talking about, and that you get to a point based on what we're seeing in terms of test positivity and cases and hospitalizations, all the metrics that we've gotten very used to talking about, and then there are really sort of public health coming together and thinking about kind of what does it look like, thinking about lifting some of the restrictions. We're clearly not there yet, and it's going to be several months before we are there. But for now, the guidance would be you still want to do those things.
Dr. Marquez, you want to mention about the need to continue PPE precautions even when, mask precautions even after getting it?
Yeah, I think there's a couple good reasons for that. So one is we know it's 95% effective, but it's clearly not 100% effective. And as Dr. Cinti mentioned, there's populations where you may not have a response, and we don't know at this point how, we have some sense of who those might be, but we don't. It's not a perfect formula, right? So there are some folks where this will not be as effective in others, and so we want to make sure that those folks are still protected by wearing the appropriate PPE. And the other thing is what Dr. Malani mentioned, is that these studies really were not designed to assess whether or not somebody gets infected and still is infected and infectious, right? So can they get others sick? It really was not designed for that. It was really designed to see whether or not the person themselves has a COVID infection. And so for both of those reasons, really, regardless of if somebody's vaccinated or not, we have the same recommendations for both folks in terms of PPE, in terms of wearing a mask. If you're a healthcare provider, we have the same recommendations in terms of eye protection, wearing a face mask and wearing a gown, if you've seen those folks. Nothing has really changed. And the other thing I will say is, I expect this to change. I don't know when, but even if you're fully vaccinated and you're exposed, we are still currently recommending the same quarantine guidelines as before. I think with more data and more we understand about the vaccine, this will change, but the current CDC guidelines are not taking vaccine into consideration yet.
Yeah, and it's understandable that there's confusion about this out there, because most of you think, gosh, I get a flu vaccine, I'm protected. I don't have to wear a mask. I don't have to worry about transmitting it to my kids, to my parents, to my other family members. But we don't know everything about the way this virus acts after people are vaccinated. You may be fine. I mean, most people are going to be fine, but you could have it asymptomatically in your nose and then spread it to somebody else who hasn't been vaccinated yet. So there will be a point at which the CDC says, okay, we can do masks off in these situations, but they haven't yet.
And it sounds like you're advising us that until that happens, to continue as we are right now.
Yeah, absolutely.
Dr. Malani, I interrupt you. Forgive me.
Yeah, no, it's okay, Andy. I just wanted to echo on kind of what both Juan and Sandro were saying is that, no vaccine is really 100% either. And when you think about flu vaccine, I mean, that's typically, 40 to 50% efficacy. So it doesn't, make the risk of acquiring flu zero. But there's also other benefit, is that if you acquire flu, you're not going to be as sick as if you didn't receive the vaccine. Now, the mRNA vaccines are clearly much better than that. 95% is better than 40 to 50%. But we're still, we're still kind of watching carefully to see kind of what happens.
One question that we got a lot of recently, obviously, relates to this new strain or strains that we are seeing from the UK and now apparently from Brazil. Does this give you any greater sense of worry that this could mutate or something that would not be effective with the vaccine? Or is this an issue of transmission? Could you tell us just a bit more about what to think on that issue?
Yeah, Juan.
Yeah, I mean, I would say that that is a great question, right? And I think there are several unknowns about that question, right? We have seen there's three main variants, I think, that sort of have been very well publicized at this point. One is from the UK, right? The UK variant. One is from Brazil, and then one is from South Africa, right? And so I think we have seen some of the UK variants here in the Washtenaw County community. I think that we've sent messaging about that. It's still, it is still by no means the predominant strain. It's just, we've seen clusters, a few clusters of these. And so from a public health standpoint, we've been very aggressive to try to contain these variants, right? Truthfully, we don't know if there's additional clusters that we just haven't identified, but for now we are acting upon the idea that these clusters are the only ones that we've seen, and we use sort of good old-fashioned public health practices to really try to contain these clusters, test and make sure that these aren't spreading to above and beyond where we've identified them, right? And it so that's we had a testing a pop-up effort over in Pioneer High School, and we'll have more sort of over the course of the next 4 weeks. So that is from a public health sort of containment and case investigation mitigation standpoint. But from a vaccination standpoint, what this tells me is that we need to vaccinate as fast as we can, right? And so the more opportunity that a virus has to replicate, the more chances it has to make mistakes, right? And so I think that the more we are able to quickly vaccinate especially our most vulnerable folks, the better off we will be in terms of preventing additional variants, but also in terms of introducing the variants that we have from other parts of the world. And so I think that's the kind of the main message is we want to delay as much as we can in terms of introducing these other variants and spread of other variants, but with the hopes of vaccinating it as quickly as we can in parallel.
Yeah, and I just add that in terms of what we're seeing, and again, this information is really changing really on a daily basis on what we're learning. But what we do know, at least for this B.1.1.7, the UK variant, it looks like the vaccines are quite effective, and they're probably effective for the other variants. They may be less effective, but I think we're continuing to watch that very carefully. And I think really one of the take-home points that Dr. Marquez just mentioned is really it is we want to get as much vaccine into arms as quickly as possible, and we're really hopeful that the transparency around the distribution process will become a bit more clearer.
Yeah, these just to compare it to influenza, this virus in general doesn't have as much capacity to change as influenza, and many of you need a different influenza shot every year. We may need that for this coronavirus too. This COVID-19. We may need a new shot every year. And the way, again, I will say this, I will be the third one to say this in this group, is really coronavirus doesn't change very frequently, except when it's all over the world in a pandemic like it is now. The more people that it's in, the more likely it is to change. And so getting the vaccine out there, doing the things we can do to keep people from getting infection. So, kids who are saying, I'm not going to get sick if I get infected, they could potentially, but they're another transmission point, another point of possible mutation. So everybody should feel that it's their responsibility to keep this from spreading. And there are different ways to do that, of course. And social mitigations, Michigan's done a great job. Our governor's done a great job to keep things down. And now we have vaccine, and we're getting that to the arms of people that need it.
Dr. Cinti, just to build on part of what you said, go ahead.
I was just going to highlight one last added sort of benefit of the mRNA vaccines is that should the strains change, and should what we see change with variants, et cetera, the ability to change the formulation of the vaccines, because these are a little bit different than vaccines that you have to grow and that take a longer time to adapt. But this technology actually makes it very doable should the need arise to provide an additional dose or a change in sort of the allocation process.
Thank you, Dr. Malani. And Dr. Cinto, you had mentioned young people. One of the issues that we've heard from many members relates to reopening schools. And a question just is, with what you are learning sometimes on a daily basis with different variants of COVID, does that in any way, shape, or form change your thinking in terms of the pace of school reopening or anything in that logistical tangle?
Well, I'll let Dr. Marquez start with that, because that's definitely something he's dealing with at this point.
Yeah, that's a really good question. So I think that when we work with schools, so I cover both Washtenaw County Health Department and also Livingston County Health Department, right? And so one of the questions that we really work with the schools and leadership is what is your ultimate goal in terms of your teachers, your community, right, and your students, right? And it sounds like sort of a fluffy answer, but it's really not, and it's a really important part of a lot of our discussions, right? The reason I say this is that if the goal was to prevent all disease, period, right? Zero disease in a school, then you would not open, right? Because there is always a potential for kids are less susceptible, but there's always a potential for kids and teachers to get sick, right? And so that's it, versus if the goal of the school and the parents and the community is that they want to have, they really think that the most important is to get the support services they need to go to school, right? And so then that allows us to have these conversations to understand what really is the goal, because schools function they have many functions. It's not just education, it is a whole series of functions, right? Some you can maybe do virtually, some you can't. And so a lot of the conversations that we tend to have is really what is the goal of the school community, and then we try to work with them on what is the safest way to achieve that goal, right? And so as an example, most of the schools in Livingston County are open, right? There's an opportunity for virtual options, but when we talked with the school superintendents, they really felt that they thought that the in-person social engagement was probably the most important part of what they focused on, and they certainly and then geared a lot of the sort of the setup to social distancing, sort of maybe changing some of the schedules in place. And so certainly in a district like Livingston County, we have seen cases in students. We have not seen much in school transmission, right? We have maybe a very small number of documented in school transmission. And so I think that is sort of the point with this same variant, right? How comfortable, there's, as far as we know currently, it does not change dynamics in younger folks, as far as we know. And so the first question is really, what is your goal and how much risk are you willing, sort of uncertainty are you willing to sort of use, and what are the mitigation strategies to mitigate that risk? And so it's a bit of a long answer, but I think that's sort of the fundamental question many times that we address with schools.
Yeah, and frankly, if you look at the way transmission goes, it's not in the lower grades. It really, a lot was happening among the high school students in the beginning of this epidemic, not much in the lower grades. And if you look even at the university level, there wasn't much spread within classrooms. So there again, it's what is the risk that you're willing to take, and it's an important question. And I know that Washtenaw County is doing a good job trying to get the older teachers in to get vaccinated, and that makes a lot of sense too.
Yeah, I think this is an area that's dear to a lot of us, definitely dear to me, as I have a fourth grader and a sixth grader. And I think to echo in on the comments is where we are now, it's, almost the end of January 2021, our understanding of what actually happens in schools, we have a lot more information and sort of evidence-based, based on sort of data and metrics to kind of understand what actually happens. And really in-person, in-school transmission inside the classroom doesn't really seem to happen. We know that masks work, we know that distancing works, we know that there are ventilation aspects, and that you can actually make the environment really sort of conducive to do those things. What we do know about schools and transmission is often tied to actually not inside the classroom, either locker room, extracurricular activities, things like that. And regardless of whether it's what we're seeing now or it's a new variant, all the prevention aspects don't change right now. Masking, distancing, being accountable for your symptoms, staying home if you're not feeling well, all those measures are fundamental to being successful with schools, et cetera.
Thank you for that information. One question that we've gotten a lot of pre-event and during and in the chats relates to the timeline between the first and second vaccination shot and the issue of vaccine supply. And obviously those are related. Folks are worried, I got my first shot. What if they run out of vaccine or don't get it in time for my second shot? What should we know about the timeline issue and the broader issue of vaccine supply and demand?
Yeah, I can start with that. So the CDC has said that they give a range, but also they have said now that if somebody misses or isn't able to, or in their hospital or something, up to 6 weeks later, they can still get either of those two vaccines. And frankly, it's probably longer than that. We're never going to give 3 doses. So I think people need to understand that. You'll get your first dose, and at some point you'll get your second dose. We're never going to start the series over unless it's been a whole year since somebody has gotten vaccinated. So you will get your second dose. So, and it will be protective. So I think that we can reassure people on that front. When we're going to get more vaccine, we're getting trickles of vaccine in now. We don't know like Dr. Malani said, we don't know from 1 week to the next how much vaccine we're getting. It's not the fault of the state. It's not the fault of our hospitals. It's not the fault of our healthcare departments. It's at the national level, I think there was some concern that we didn't know exactly how many doses were stockpiled, and there weren't as many doses stockpiled as we thought there were. And so we're waiting now for production of more. So we have to adjust with our dose, the way we give our doses.
Yeah, I don't really think there should be concern I don't think that there should be concern about whether or not you're going to be able to get your second dose. I think everyone the idea behind this is not to give people one dose and
Right.
to kind of, call it, because actually that's an environment where you don't have full protection, and it's an environment where when we start talking about the virus sort of mutating, that actually makes an environment where that would be conducive to that. And so I think if you get one dose, the absolute plan is to get a second dose, and I think you can count on that. And with the stipulations that Dr. Cinti mentioned, I think the goal is right around that 3-week mark for the Pfizer vaccine, right around the 4-week mark for the Mrna vaccine. But if it's going to be a little bit over because of whatever happens, that's going to be okay. But we as sort of working, the health systems and the health department, we absolutely let you know if that was the case.
Yeah, and we're protecting our second doses at Michigan Medicine, and I know you guys are too. We're saying we are guaranteeing second doses over giving first doses. So we really believe, and we feel that you don't want to go against the studies. The studies gave 2 doses, not 1 dose.
The one thing that will be hopefully in the future will be this, one of the vaccines coming up, hopefully is a 1-dose vaccine.
Yeah.
So hopefully, with that, we'll have to look at the data. Dr. Cinti or Dr. Malani, I don't know if you've seen the data, but I'm curious to see what it looks like, because I think that will be a great addition, right? It's a 1-dose vaccine. You get 100, it's 100 million. It's 100 million people that can be vaccinated. So I'm very excited about that.
Yeah, it's the Janssen vaccine, right? I think, Dr. Marquez. I think it's Janssen.
Yeah.
Doctors, from your experience, is there any hope with the use of the Defense Production Act that vaccine development will increase and ultimately supply will increase?
Yeah.
That is above my pay grade. Not that one.
Understood.
Yeah, I mean, but I think it's important to recognize that clearly, one of the administration's goals is to be much more transparent and communicate much more about sort of COVID response. And I think I just saw something today that there's going to be 3 times a week that they're going to be having forums where a lot of this information is going out. And as a part of that, I mean, clearly there's been a lot of discussion about the Defense Production Act, not just about vaccine development, but readily having more testing available, having enough PPE and all those things that we suffered from a bit in the spring.
One question we've seen in the chat relates to the timeline for essential business employees. Obviously, the first tranche has been related to healthcare workers. and then those over 65. Is there any sense in terms of when somebody who's working at a grocery store or at an auto facility or something that is deemed essential, where they might be sort of up for their turn in the queue?
That's a great question. I would say that I hate to echo what we said before. It's really vaccine dependent, and so we know the numbers of folks who are sort of meet essential category, and so we have estimates of that, and it depends on how much vaccine to get to kind of figure out how quickly we can get through them, right? So, as an example, if tomorrow the recommendations were to include them, right? Right now we have prioritizations from the state, but if they were to expand to include additional, we wouldn't be able to, we just can't get to them quick enough because of the delay in vaccine. So I think, that is the big part that is the big unknown. And I think will be the part that will affect the timelines more than anything else. I think once we are, if we do have, I think if vaccine does not become a limitation, and it's really, I think we can have a better sense of what the timeline will be. As Dr. Malani and Dr. Cinti mentioned, I mean, from a capacity, just like from a county capacity, we are probably using maybe 1/6 of our capacity right now based on the vaccine availability, right? So we could probably just like using current infrastructure, ramp up probably 6 times as much vaccination if we had the vaccine.
And ditto it, yeah.
Yeah. Yeah, I mean, exactly the same. The ability to give, thousands of vaccines on a daily basis, both through St. Joe's Health Department as well as IHA, and we just, we have the ability to do it, the capacity to do it. We just don't have the product.
So the decision on deeming essential is at the state level, and then it becomes a supply and demand issue, which you have explained to us.
Well, so it starts at the national level. The Advisory Committee on Immunization Practices, which is the CDC Advisory Committee, they have convened groups. They have convened their group to look at each of the priority categories. Then they put out their priority categories, and for 1B, it was greater than 75 and essential and frontline essential workers, including teachers, grocers, people working in food production. So there are a whole list that are considered frontline. Then the states take that, and our state took that, and they have modified it for the state, and it's reasonable, and the federal government allows for that. And so our state modified it to say, okay, 65 and over, because we know older folks are at higher risk. So let's take the 65 and olders. And the essential workers are also in 1B, but they're in lower tiers of 1B, where, as Dr. Marquez said, when we get the vaccine, those people will start to be brought in. Grocers, there are teachers being done right now, of course, right? I think there are teachers that are getting it, but they have to be sub-prioritized for high risk people more than others. So, yeah.
Yeah.
So it goes from the federal government to the states, and then we follow that.
Yeah. And I'm just going to point out that it's often, depending on where you are, it's right now we're still going through some of 1A, but we're also doing 1B concurrently, and we're sort of at I think the goal is really whatever vaccine we have available. I think we all had mentioned this before, is trying to use this as quickly as possible. And so the likelihood of sort of crossing over between groups, as long as one group is mostly done, is very likely to happen.
Yeah.
And I think the final part, I think, is sort of administrative, is that if you look at some of the numbers, it does look like, we're, if you look even by county, it looks like we haven't administered as much as we've been given. And a lot of that is just, I think, is sort of delay in reporting numbers. I think everybody here basically, is basically running out of vaccine by the end of the week. So I don't think that, some of the reflections on some of the data is truly accurate. Where, I think if you look at it, there's maybe some thought, it's only administering half as much. I think that's not really accurate. I think there's a delay in reporting in some of the sort of different data systems that have to talk to each other.
In terms of data systems and structures and so forth, one basic question is, if I'm employed and get my health insurance there, do I go to my employer or my provider for information? If you're not employed or retired or for whatever reason, where do you go? Any good advice on that?
Yeah, so I think that's a good question. And so we tried at the health department to really have a lot of information about, where, one is what phase we're in, and then two, where you might be able to go, right? And so I think we've worked with Michigan Medicine, St. Joe's, and IHA to, sort of mirror verbiage from their communications folks, so that it's clear, hopefully as clear as it can be in terms of where's the best place to go, right? So for example, somebody's 65 and they have a Michigan Medicine provider. I think that they're getting communication from Michigan Medicine about vaccination efforts. Same thing if somebody's greater than 65 at IHA. If somebody has a independent goes to an independent doctor with an independent clinic, they don't have any other resources. I think they're our primary focus right now. And typically most of the, and everybody sort of on the essential workers right now is going to be done through the health department, just because of the focus of the 65 and older focus for the different health systems. And so, but I think that this is, again, when we talk about the collaboration and the communication between our different partners is really, we meet weekly to talk about this. And I think that, if we're finding that there's a big delay in a key group that we just, that we need to get through, I think there's a lot of, we've had a lot of conversations about what is the best way to do that.
Doctors, we're up against a 2:00 start. We know your time is precious. We thank you for it. Is there anything that any of you would wish to sort of leave us on, be it good news, bad news, indifferent, or any point you wish to emphasize again?
I'll start here. I think from a public health standpoint, I really want to, I know that we're all tired of, of COVID and public, and sort of some of the restrictions we had to do. We all want to see our friends and our family and our loved ones. I think everybody might be tired of wearing a mask, right? I think there's a certain fatigue that's really sort of come in. And I think that what I would say is that, I think right now is not the time to give up and just say, just kind of let things go to laissez-faire, right? We've talked about the concern for the variants. We've talked about sort of the concern for, that our numbers are looking better right now. I think it's time to double down and really do what we've been doing and really try to do it, twice as hard, right? Wearing a mask, staying away from social distancing. If you go out shopping, staying away from others, really having your small, home pod of folks. And I think the reason for that is that, again, we kind of see the light at the end of the tunnel, right? And so I think that if we're able to combine both these very effective public health practices with sort of ramping up vaccine, over the next, weeks to months, I think this is really how we come back to sort of our new normal. And so I think, I would just say that folks have to really, really, kind of work hard for the next, few months to really try to double down on these.
Agreed. Yeah. Go ahead, Anand.
Yeah, I mean, I 100% agree. I mean, look, 2020 was a very difficult year for all of us. And 2021, I mean, if you look at kind of where we are with respect to COVID, I mean, things are the best that they've been in a few months. And I would imagine that every day is a step in the right direction. And, 50,000, citizens of Michigan getting vaccinated, I mean, that's not where we're going to end up at. That's where we are now. And that's with many of the issues that we've highlighted. I think things can only get better. And I do think that, we will come to a time where we'll get out of this. There's obviously a lot of lessons to learn. One of the real positive aspects, if there's anything positive, is our ability to work together with other health systems as a county and through public health. I think there's a lot stronger relationships there, which is good. But I'm hopeful and optimistic kind of for where things will go, and I'm confident that things will slowly get better.
Yeah, agreed. I think we need to. I think it is optimistic. I think that most of us can't believe that things are going to get better sometimes, but all the indications are out there. We have the vaccine. We have the capability to produce more vaccine. We know how to manage this in the state so that more cases don't occur. So I would say you're going to get vaccinated. We are trying as hard as we can, but it's a good thing, and you will get vaccinated in the next several months. We're going to be working towards that.
Keep up current safety practices. Trust the efficacy of the vaccine. Stay tuned for attention in terms of administration, and have some level of optimism going forward.
Yeah.
Doctors, we appreciate your time here today. We appreciate the work you do as healthcare providers. And thank you for bringing some knowledge to an issue that is obviously important to people. And we appreciate everything you've done here with us today.
Great. Thank you.
Thank you.
Take care. And thank you all for being with us. A2ychamber.org for all our other events. And if you have any questions, our staff contact information is up on the website. Be safe. Take care. Thank you again for being with us.
Thank you.